Reduced blood supply to the heart is the cause of angina, a particular type of chest discomfort. A sign of coronary artery disease is angina. Angina pectoris is another name for angina. Squeezing, pressure, heaviness, tightness, or discomfort in the chest are common angina pain adjectives. It could feel like there is a big weight on your chest. Angina can cause either fresh discomfort that has to be checked out by a doctor or a persistent pain that gets better with treatment. The discomfort of indigestion, for example, can be difficult to distinguish from angina, even though it is a rather common type of chest pain. Seek immediate medical attention if you experience inexplicable chest pain. Types: stable angina, unstable angina, variant angina, refractory angina. Symptoms: pain and discomfort in the chest are angina symptoms. The discomfort or pain in the chest could feel like. Also possible locations for burning, fullness, pressure, or squeezing pain include the arms, neck, jaw, shoulder, or back. Other angina symptoms include dizziness, fatigue, nausea, breathing difficulty. Sweating angina can range in intensity, duration, and type. Unstable angina, a more deadly form of angina, or a heart attack may be indicated by new or different symptoms. You should see a doctor right away if you experience any new or worsening angina symptoms so they can diagnose you with stable or unstable angina. Angina in women. Women's angina symptoms can differ from men's typical angina symptoms. Delays in getting treatment could be caused by these distinctions. For instance, although chest discomfort is frequently experienced by women with angina, it may not be the sole symptom or the one that affects them the most. Women may also experience symptoms like neck, jaw, teeth, or back discomfort, nausea, breathing difficulty instead of chest tightness, a stabbing ache, abdomen, tummy pain. Causes: reduced blood supply to the heart muscle is what causes angina. The oxygen that the heart muscle requires to survive is carried by the blood. Ischemia is the medical term for the disorder that results from the heart muscle not receiving enough oxygen. Coronary artery disease is the most typical cause of decreased blood flow to the heart muscle, CAD. The fatty buildups known as plaques can cause the heart's coronary arteries to constrict. Atherosclerosis is the term for this. A blood clot or plaque rupture in a blood vessel can abruptly restrict or stop blood flow through a constricted artery. Blood flow to the heart muscle may suddenly and significantly drop as a result. The heart muscle may be able to function on the lower amount of blood flow when there is little oxygen demand, such as while one is at rest, without experiencing angina symptoms. Angina, however, can happen when the need for oxygen increases, as it does during exercise. Risk factors. The risk of angina may be raised by the following factors: advancing years. Adults 60 years of age and older are particularly susceptible to angina. Heart disease in the family history. If your mother, father, or any of your siblings have ever suffered from heart disease or a heart attack, let your healthcare professional know. Using tobacco. The lining of the arteries can be harmed by smoking, chewing tobacco, and prolonged exposure to second-hand smoke, which makes it possible for cholesterol deposits to build up and obstruct blood flow. Diabetes. Diabetes accelerates atherosclerosis and raises cholesterol levels, increasing the risk of coronary artery disease, which causes angina and heart attacks. Elevated blood pressure. By promoting artery hardening over time, elevated blood pressure harms arteries. High triglyceride or cholesterol levels. Atherosclerosis can be brought on by having too much low-density lipoprotein, LDL, in the blood. Angina and heart attacks are more likely in people with high LDL levels. Triglyceride levels that are too high in the blood are likewise unhealthy. Other health issues. The risk of angina is increased by chronic renal disease, peripheral artery disease, metabolic syndrome, and a history of stroke. Inadequate exercise. Obesity, type 2 diabetes, high blood pressure, and high cholesterol are all consequences of a sedentary lifestyle. The kind and volume of exercise that is appropriate for you should be discussed with your healthcare physician. Obesity. Angina can be brought on by heart disease, which is at risk due to obesity. The heart has to work harder to pump blood throughout the body when a person is overweight. Emotional tension. Blood pressure can be increased by excessive stress and anger. Stress-related hormone surges can cause artery narrowing and exacerbate angina. Medications. Prinzmetal's angina may be brought on by blood vessel tightening medications, such as some migraine medications. Drug abuse. Cocaine and other stimulants can lead to angina and cause blood vessel spasms. Chilly conditions. Cold exposure has the potential to cause prinzmetal angina. Complications. Angina can cause chest pain, which can make some activities, including walking, problematic. The most dangerous side effect, though, is a heart attack. Warning signs and symptoms of a heart attack include: the center of the chest feels full, compressed, or pressured for more than a few minutes. Besides the chest, there may be a pain in the shoulder, arm, back, or even the teeth and jaw. Fainting. Sense of impending doom. Increasing number of chest discomfort episodes. Nausea and diarrhea. Ongoing discomfort in the upper belly, abdomen, breathing difficulty. Sweating. If you experience any of these signs, you should get emergency medical help right once. Prevention. By making the same lifestyle adjustments that are used to treat angina, you can help avoid it. These consist of: not a smoker, consuming a balanced diet, limit or stay away from alcohol, doing regular exercise, the upkeep of a healthy weight, taking care of various heart disease-related medical issues, lowering stress, getting the appropriate vaccinations to prevent cardiac issues.
For any questions, leave a comment below and don't forget to subscribe.